Hello, everybody. This is Chloe Lim with Becker's Healthcare. Thank you for joining us for today's webinar, Doing Nothing Isn't Neutral, the right way to manage estates in an aging America. Before we begin, I'd like to walk us through a few quick housekeeping instructions. We'll begin today's webinar with a presentation, and we'll have some time at the end for the Q&A session. If you have any questions, please feel free to submit them at any time throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded, and it will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have any issues with audio or visual, just try refreshing your browser. You can also submit any technical questions you may have in the Q&A box, and we're here to help. With that, I am pleased to introduce today's speakers. Nikki Stackhouse, VP Revenue Cycle at Prisma Health. Garrett Cates, Executive Director of Patient Services, Mercy Health. Drew Mahone, Executive Director of Billing Operations and Revenue Cycle at Johns Hopkins Medicine, and Angela Horn, VP of Business Development and General Counsel at DCM Services. Thank you all so much for being here today. And with that, I'm going to turn the floor over to you all to get us started.
Awesome. Thank you, Chloe. Hello, everyone, and thank you for joining us today. We are calling today's discussion Doing Nothing Isn't Neutral, because when we talk about creating the right kind of process for the growing decedent and estate populations, doing nothing will leave your organization exposed from a compliance perspective. There's risk about failing to comply with CMS's rigorous requirements about estate searches and the need to show that a debt is actually worthless under the regulations. There's also risk from a HIPAA and state privacy law perspective, and even in FDCPA and state consumer protection laws concerning debt collection. Failing to identify an estate and a personal representative means invariably talking to the wrong person, otherwise known as third-party disclosure. What happens also is that accounts will inadvertently fall into traditional collection streams that are not designed for the very important survivor-sensitive experience that you work so hard to create. It's another way to say patient experience. Finally, you'll miss out on millions in important revenue your organization really needs to thrive. We realize that there's a real drive to dismiss this seemingly small part of the business with so many challenges facing rev cycle leaders, but we're going to show you why doing nothing with decedent debts and estates just isn't a viable option. So just briefly to introduce DCM Services, for 2.5 decades, DCM Services has specialized in the areas of estates and bankruptcy and these very special expertise-driven areas of revenue cycle. We work with 46 of the 50 largest health systems in America and 83 of the top 100. And we're very proud to introduce you to some of our clients here, panelists, and we'll begin with them in just a moment. So panelists, you have all made a choice to build the best-in-class program with DCM Services to manage estates from all those angles I just spoke about: the most patient or survivor-sensitive approach, the strongest compliance, and the most revenue. I'm going to set the stage with some meaningful trends. So talking about the aging populations, we have a very large population bubble that has aged into this category. We have combined that with high end-of-life care costs, which some refer to as 70 to 80% of all lifetime healthcare expenditures coming in the weeks and months before an individual passes. And then a rise in the self-pay component of the bill. So all of these things are coming together to mean that the opportunity on all fronts that I just spoke about is larger than you think and growing, and predicted to grow through mid-century. So we're going to start with, of course, our panel, which I know is what you all are dying to hear from. And so panelists, we're going to ask you a series of questions about why you chose to create a specialty process around decedents and estates, and what results you've seen, and what advice you might give for your peers. And so I'll start with the questions. Before you started working with a dedicated partner, DCM Services, how was your team handling these accounts? And what did the process look like from day to day? And I'll pick on Garrett to start with.
Yeah, thanks, Angela. For Mercy, before we started our partnership with DCM, my team's workflow was very reaction based. So think of it day to day. My team was responding to basically what showed up in their work queue, whether that was notices coming through our correspondence team or just fielding those inbound phone calls from family members asking us to update our records in the EHR. When I stepped into this role, there really wasn't a formal process, if you will, or a dedicated support model in how we were navigating and handling these accounts. So the team at that point, we were really doing the best we could in that we were flagging the patient record and essentially putting the AR in an outsourced status while we attempted to figure out what the long-term approach would be. I think you're exactly right in regards to we understood that there was receivables that truly were recoverable, but for us, we just didn't have that workflow put in place in a way that we could support.
Andrew?
Thanks, Angela. And ours was very similar at Johns Hopkins to Garrett. It was kind of handling them one off as they popped up in our work queues. We did kind of, start to see an increase in opportunity to collect on these estates. And so we did, initially start by hiring, we had one person who would basically contact the courts, one guarantor at a time to see if there was an estate, and they were responsible for all follow-up and everything like that. And we were also, filing what was called a demand for notice with the courts, which can often be costly and rarely kind of, got us to where we needed to be. So yeah, I think our main issue was that we weren't really scaled to be able to handle the populations that we were trying to follow up on.
Awesome. And Nikki?
Yeah, very similar to Garrett and Drew. When I got here, there's 1.5 FTEs dedicated. And really what they would do is they would just look at patients that were already marked deceased. They would field some of the inbound, from families. We were getting information to update the system, but they would go out, look for estates. It just wasn't a lot of resources for what we knew was out there.
Awesome. All of those common experiences to other clients that we have as well. Okay. What was the moment or trigger? So you have this going on. What was the time at which you said, I think I have to do something different here? And I'll pick on Garrett again to start with.
Yeah, not a problem. Yeah, and kind of like for our workflow was a little bit different in that we weren't staffing FTEs to manage the volume or really even follow up with the courts. So for us, when I stepped into this role, I really saw what was a growing volume of truly uncollectible revenue. Because like I shared, we were tagging it as such within our EHR, but really not taking any action on it. And even in that, we understood that taking no action on it, that was a risk all on its own. So even for me, prior to coming into this role at Mercy, I spent time leading our patient receivables within our contact center team. So for me, it was really important that I understand how difficult these patient billing interactions can be, even under some of the best circumstances. And especially when you're supporting a family member after the loss of a loved one, that in of itself required a different level of expertise that we were looking for. So, Angela, it's not the best way of recognizing the issue since it was growing, but I know for Mercy, it was really important for us to find a partner in this space rather than just a vendor, since we place such a high emphasis on patient experience.
Yeah, that makes sense. And Nikki, I think you mentioned that when you joined your organization, you were surprised that there wasn't a process.
Yeah, where I came from, we did have a decent process using a partner. But it wasn't really until there was a lot going on when I first started, we went live with SBO, and it was about a year after that, after the dust settles from SBO, these FTE resources had gotten pulled into other priorities. And so we saw the AR grow in this deceased bucket. And so there was really just no attention to it. And so we knew we needed to do something.
Awesome. Yeah, growing volumes is a common refrain, it sounds like, to what we spoke about at the very beginning. Okay, so I think, Garrett, you kind of answered this question already, but maybe Nikki, you can take a shot at it. What made you decide to bring in an outside expert like DCM Services rather than trying to build it internally?
It was kind of like what I just said, where the volume had grown so much. And then I asked the question, knowing kind of the background, I asked the question of like, okay, so this is our own population of patients that we know are deceased. We know that there's a growing population of patients that we have no idea that they're deceased. And so that was the real kind of pivotal moment of like, we need somebody with that technology, with the resources to help us do that.
Awesome. And Drew, did you want to comment?
Yeah, I mean, it's basically the exact same here. We had a growing population of deceased patients, and we weren't collecting on those. And I think we identified that we had an opportunity, just based on conversations with other groups, that there was an opportunity here, and there were other groups who were using kind of outside resources just based on kind of the niche nature of the follow-up here and the legal requirements that go into it and contacting the courts. And it wasn't really something that we had the expertise to do at scale. And it would have been very, very costly for us to grow internally to be able to do it at scale. So it made more sense to kind of, outsource this work to someone who already has the expertise and really the focus on the specific scenario.
Awesome. Makes sense. So in terms of like looking at the problem, it seems like all three of you were able to determine that there was an area that needed attention in terms of decedents. But was it visible to the rest of the leadership team, or was it kind of in the background, something most people weren't aware of?
Yeah, I don't mind to take that one, Angela. I know for us, it certainly wasn't a top priority when we think of all the battles that we take in a day-to-day respect within revenue cycle. I know, denials and other uncompensated care certainly are the more higher priority that we have to focus on. But I know at least when we were monitoring our KPIs and looking at, I think all three of us are collectively saying the same thing. When we saw those aged receivables start to grow, that we knew at that point we had to take some type of action.
Yeah, it's similar with, I mean, it was really just an opportunity. It's not just from a dollar standpoint, obviously the number one priority, but it's an opportunity to kind of to cut down some of that self-pay AR that typically leads to, bad debt and ultimately write-offs. So it was something that, we became aware of in a RCM space, and then, elevated to our CFOs to kind of get them on board as something that, makes sense to pursue over time. But it wasn't immediate. It took some, prioritization amongst other initiatives.
Definitely, and you're in a challenging landscape from a regulatory perspective in Maryland. So I know we work together to create a very specialized process in that respect.
Yeah.
Okay. Well, panelists, what made you? Or sorry. Let me back up. Walk us through what your state process with DCM Services looks like now. When an account is a decedent account is identified, what happens? Drew?
Yeah, sure. I mean, I think number one, you all are able to find a lot more states than we were, just based on kind of the resources you have. And then, you all present a claim. We have many guardrails in place to your point earlier to accommodate some of the Maryland specific rules that we have. There's very specific rules in Maryland that regulate when and how we can collect on self-pay balances. That made it a little more complicated. But then, you all submit the claim, you follow up on the claim, and to the extent there's money in the estate, you're able to collect a percentage of that. So
Awesome. Nikki?
Yeah, I mean, we were doing such a reactive approach before. I think now with DCM, it's a more proactive. Um, Instead of just doing the patients that we know are deceased, we're able to do the outreach and identify decedents who had passed outside of our facilities. And then really there's the response file. It triggers a billing indicator in our system to let us know that, hey, this needs to go to DCM. It then gets kind of, put on the side so you guys can do what you do, which is really ultimately recover dollars that are owed to Prisma.
Right. That would otherwise go unpaid.
Right.
So moving on about how you built it, how did you integrate the partnership with DCM into your existing revenue cycle? Was there resistance from your internal team? And if so, how did you work through it? And I'll start with Nikki.
Yeah. So considering we were having 1.5 FTEs on a good day with this process, my team was not resistant at all. I think they were looking for that help. They were looking for that expertise that they just had kind of been thrown into. Like, this is a process. Here's a half FTE more, to do this. So DCM really, I think, helped my team feel secure that we were doing things compliantly and efficiently. And so it was one of those things where we don't have to worry about it anymore, and we can let DCM do what they do.
Definitely. I think it's those folks who have a view from the trenches who realize really how difficult this work is to do, where others might not. Garrett, did you have a comment?
Yeah, I would just kind of echo what Nikki shared just on the compliance and that piece. I don't really think there was significant resistance from our team. I know that for them, they were very mindful of, again, the patient experience aspect in all of this. And so I
Yeah.
think over time, for them hearing that just from interactions that DCM was having with our patients and their family members in the compassionate approach, that it was very consistent to the same Mercy caregiver conversation that they would have. So I think a lot of that helped build the trust internally and just reinforced it was the right partnership for us.
Yeah,
Yeah.
that makes sense.
At Hopkins, we had one person kind of working on an island, owning all of this herself. So she was definitely not resistant to pulling in additional help. And she's still involved in this very, very heavily, working kind of directly with you all as on the Hopkins side. So yeah, it was well received at Hopkins as well.
That's true. That person is typically our subject matter expert, so that we're building something, recognizing what's happening before and how that needs to change is very important to get into the weeds. Okay. Was there anything that surprised you about what your specialized partner, DCM Services, was able to uncover or recover? And I'll start with Nikki.
Yeah. So what you're able to uncover, it didn't really surprise me. I know that there's such an importance in this space when it comes to just compliance, dealing with patients, families, recovering dollars, that I was more surprised that we didn't have it already. So a lot of this was getting that in place. My team, again, was very open to having another service, experts come in and really help us with this. So nothing surprising. Everything's kind of working as expected. So
Awesome. And Drew?
Yeah, I echo what Nikki just said. Nothing really surprising. I think I knew that there was a major opportunity here, beyond, I think to your point earlier, the patients that we knew were already deceased at our facility. I think that's the biggest difference, is the amount that are uncovered that were deceased outside of our facility. So not really surprising, no.
Yeah, that's one of the things that sometimes can be the most surprising to a partner, is that there are literally thousands of individuals that have passed away outside facility, that they are not notified of. So they're just sitting there in traditional collections, and not being pulled into the specialized process. So
Yeah, and it's important too, because you want to handle those differently, and you don't want to just continue to send them statements and the bad debt. So
exactly.
it's definitely important to uncover that when we can.
Okay, how about this? And you can share a specific example, or you can talk about a trend. You don't have to, of course, share a specific example, not anonymized. Do you have anything that you can recall in terms of specifics about the process in general? And I'm going to pick on Garrett again.
Yeah, so I think unlike, Nikki and Drew, for us in the origination of DCM, I didn't even have a FTE tackling these accounts. We were just tagging them and almost shuffling them under the rug, if you will, while we kind of figured out what we could do for this process. But I think, Angela, instead, I'll kind of talk through two examples that come to mind just on how our workflow looks with DCM today and how we were ultimately able to iterate on that process. So I think I've mentioned patient experience a few times, just kind of going through this. And one of the things that we have recently introduced is more of a warm handoff between the family members and DCM. So instead of a traditional billing statement, when we know there's going to be that placement of the AR to DCM, we're sending more or less um, a welcome letter, kind of introducing DCM to the surviving family member. It's really helped to be more proactive in explaining DCM's role and why they're
Right.
doing that outreach, kind of setting those expectations. And at least for us, it's reduced a lot of the confusion and kind of improved the overall experience overall. But then the other piece that I'm really proud of is we worked closely with your group on kind of modifying the when and the how of the placements.
Mm-hmm.
And from that work, we've seen just an overall improvement in the average DOD, the overall recovery. And it's really been successful just in how we've been able to financially recover from more accounts by really accelerating the placement.
Yeah, that's something to call out for the audience that if you don't know a lot about estates, they're very time sensitive. If you have a trust, they can oftentimes make distribution right away. If you have a probate, you oftentimes only have 90 to 120 days to get your claim in and to be entitled to payment. And just to expand a little bit on what Garrett said about the letter that Mercy sends before accounts are placed with DCM, it makes clear something that we do at DCM as well, which is that the accounts that are placed with us are not people who haven't paid their bills because they just haven't paid their bills. They are folks who haven't paid their bills because they passed away, and an estate now is the entity that's responsible. And so we want to make that process very clear that DCM is an expert in managing estates, and that's why we have the partnership, not that something is being sent to collections. And I think you mentioned something about not compliments, but complaints that I want to call out.
Yeah, no, that's I think, we've kind of talked about why we chose a partner within this space. And I know we've talked a lot about the expertise, but for at least us, it's the continued partnership and the praise that in a very difficult space that we're navigating, we don't get complaints related to DCM's interaction with our family members. And I think that certainly speaks volumes.
Yeah, I think the audience may be surprised to hear that. So thank you for sharing that. How about what has the financial impact looked like for each of you? I'll start with Nikki.
Yeah, so we're early on in the process. I think we're just still under a year of being live and working with DCM. But my expectations are high, Angela, and you know that. Like I think the expectations are to recover 10 times what we were doing internally. And again, I think that's low. That's kind of what we're thinking. But I will say that within the first 2 months of us going live, we recovered the same amount that we had been recovering in a year. So looking forward to like reaching that steady state, which we're approaching, and to kind of see really where we go from there.
Awesome. Yeah, a 10x is not uncommon. It's so difficult to do this work manually and without the technology that we have and the resources that we have, that 10x is pretty common or more. And I understand you're waiting for more, so I'll make a note of that. How about Beyond dollars, has this changed anything about how your families experience the process? I know Garrett talked a little bit about it. Did you have any comment, Nikki?
From a compliance standpoint, I mean, it's definitely it keeps us from the patient complaints, the family complaints. I mean, that's great, but there's also a compliance component when it comes to like our cost reports. I know, and working closely with my coworkers, that's really important. And then just being more confident that we are compliant and consistent with these processes when it
Yeah.
comes to our patients.
Yeah, awesome. Like one of the things we do initially in working with a new partner is just streamlining because it's not uncommon to find that if somebody passes in facility, this is what happens. If somebody is notified by a letter, something else happens. If a bad debt agency discovers something, a third thing happens. So streamlining everything and yeah, putting that compliance in place. I think there is a common misconception out there that if people even know that you need to search for an estate for something to be eligible on the cost report, they think that one call to the court in 30 days of the decedent's passing is sufficient to meet the statute, and it's not. So continued searching, documentation of those searches are definitely what creates that compliance. So yeah, thank you for sharing that. And Drew?
Yeah, I think the exact same as Nikki. I think the confidence that we are adhering to the regulatory guidelines. We were prior, but it's, having an infrastructure like you guys have, it adds another layer of confidence that, we are compliant with the regulatory guidelines, especially in Maryland. And I think we appreciate your ability to work with us to kind of, modify your processes to make sure that you adhere to those specific guidelines as well. And I think so far it's gone well. I think similarly to Nikki, we're still fairly early on. We're, I believe, about a year in. So I do expect that, as we get more into steady state, it'll look even better.
Yeah, your team was great to work with at Johns Hopkins because there was actually new legislation about the estate process that came into play as we were implementing. So really have a very specific process there, but also compliant, as Nikki mentioned. Were there accounts that you would have written off in the past? I think by your comments, I'm going to assume the answer is yes, but were there accounts that you would have just written off completely that turned out to be recoverable? Drew, do you want to start?
Yeah, I mean, like I said, we had one person following up manually on these, and as you alluded to, there are specific timelines, and it's not possible for that person to have done what is required on every single account. So yeah, many of those led to write-offs, and obviously a lot of them still do lead to write-offs, but the amount is definitely less.
I think one of the things that a lot of organizations don't even know when we first start working with them is that their explicit charity care policies say that something is eligible for charity, comma, if no estate. So right embedded in the charity care policy, along with the CMS requirement, is that you must search for an estate and collect the funds that you're entitled to from an estate, even in the charity care process.
We do. That is true, but there's still a lot of like presumptive charity that we take before we even send it to you all. So we do make sure that any charity adjustments are taken on the account before we go to the estate collection process.
And specifically in Maryland, yeah, very stringent requirements. Okay, moving on. If you could go back and tell yourself one thing before you started this partnership, what would it be? And I'm going to call in Nikki first.
Do it sooner. Wait.
Makes sense. Simple and
not much more there.
Easy to follow advice. And Garrett, did you have a comment?
I would exactly echo what Nikki shared. Especially as you see the level of opportunity now post implementation with DCM and just what dollars we're able to recover to help us sustain our mission. Certainly do it sooner.
Awesome. Okay, so final question. I'll have every panelist answer. For someone who's listening today And the whole point of this is that they get advice from you because you understand how the process works. For someone listening who knows that their estate process is maybe fragmented and hasn't prioritized it yet, what's your honest advice? And I'll call in Drew first.
Yeah, I would say, in general, we certainly prefer to do what we can in-house as much as possible, but there are certain processes that I think are highly specialized and niche that make sense to outsource. And this is one of them. I think, like out-of-state Medicaid is another one. Following up on that is hard to do in-house.
Yeah.
And so, I think it's just a balance between doing as much as you can in-house with the specific organization expertise versus, building the infrastructure and what the cost would take to do that in-house. So I think that's my advice is, not everything has to be done in-house. Certainly not everything should be outsourced, but I think there are certain things that make sense to do in-house and certain things that make sense to outsource.
Yeah, definitely. And I've heard your peers say something similar too. Like there are things that we do internally very well, and we always need more resources internally. So that if we can take off the plates of our internal folks, something that is just not really feasible internally, we can move them to areas to do something that we do much better internally. Yeah. Garrett?
Yeah, I would say and just kind of acknowledge that for, revenue cycle leaders, just the amount of pressure that we're consistently under. I know we talked about earlier, reducing denials, obviously the increased usage of AI by our payers, challenging our reimbursement and, always having that key focus of how do we manage our cost to collect. So there's a lot always on that growing to-do list, but I just think that this conversation, this work, it is an important piece to the overall equation. So even if it hasn't been prioritized within your organization, it's certainly a conversation worth having.
Awesome. And I'm going to give Nikki the last word.
Yeah, I mean, it's not in anything that Garrett and Drew haven't said. Revenue cycle, we have a lot of challenges. We have to stay up on regulations. There's a lot that we have to really do and be experts at. But we have to be able to find partners that are experts in the things that may be, too time consuming or we don't have the competencies. And I think this is just one of those areas of why try to invent a wheel when we don't have that expertise and can really lean in on and, lean on the partner like DCM to help with that.
Yeah. I mean, literally, when you look at all the priorities in revenue cycle, DCM invests millions every year to gather the data from all the different probate courts across America and build the machine that works to find them and all the things that we do, because this is all we do, right? You're running an entire revenue cycle operation, and the cost to set up a program like you have with DCM is just exorbitant. Yeah, exactly. So I think with that, I'll turn it over to Chloe for final remarks and maybe some question and answer.
Yes, absolutely. Well, thank you so much, Nikki, Garrett, Drew, Angela, for just such a wonderful discussion. We'll now begin today's Q&A. Audience members, please feel free to continue submitting those questions via the Q&A box on your screen. I'm going to take a quick look here. So let's just get started with this first question here. What is the turnaround time to collect on a claim in an estate?
So I'll take that since my team is managing this on a day-to-day basis. There are different types of estates. So if you have a non-probated estate, meaning decedent left behind assets, and typically it doesn't contain real estate or real property, it can oftentimes be administered outside of the court. And so payments from a non-probated estate happen much sooner in the first few months after a decedent passes. Similarly with a trust, I think a lot of people think a trust is created to avoid paying bills. And in fact, most trusts are not. Most trusts are revocable trusts, and they have the same responsibility to pay bills as a probated estate. But the thing that they avoid is probate itself and all the time-consuming procedure and costliness of that, which also then makes the trust able to pay faster. And then finally, the probated estate, that is what takes longer. And that can be anywhere from 18, 24 months is what we call steady state. It really just depends on what assets are in the estate and needed to be liquidated and what other things need to happen before distribution can be made. So we do see the lion's share of payments within the first 12 months from presenting a claim, and then the final 20% or so coming in by months 18 or 24. That was probably more information than than the questioner asked, but try to
No,
give
all
some
good.
color.
Thank you so much for that added insight and for that detailed answer there. Kind of building off of that, an extension I see here is what is the average percentage of estate claims to be paid?
Very good question. So the percentage of payment does also vary by the different kinds of estates. If you have a probated estate, like I mentioned, that means that there's typically a home or other real property, real estate in the estate. So they typically do pay at higher rates. And we can see as high as in the high 60%. When you put all of the estates together, the ones that are, have only enough assets to pay the high priority claims, the ones that are fully solvent and everything in between, it can be that high. I would say the average is between about 35, 25, 35, 45% on the higher end, but we do see it in the higher 60 percentages in some jurisdictions. And then when you look at trusts, they actually typically pay at higher rates than probated estates. I guess if you think about the kind of people that create trusts, oftentimes they have more assets to distribute. And then the non-probated estates pay at lower rates, typically in the single to mid-teen rates, single digits to mid-teens.
Yeah, a lot of numbers. Thank you so much for all the details. Continuing on this, I guess, trend of questions that have to do with a couple of numbers, how much time do you have? And do you ever see yourself, or do you ever see it where you run out of time because of having to send the statements first?
Okay, good question. One thing I think that is like maybe wrapped up in the question is the idea that you do have to send statements first. We do have some clients that think that before we start working together and explain how the process works so differently when a patient guarantor passes away. Instead of sending statements like you might do in the first 120 days, for example, with a guarantor who's alive and like any other patient, in the context of a decedent guarantor, what you have to do is not send statements, of course, to someone who's passed away or make phone calls to someone who's passed away. What you need to do at the earliest possible point is start looking for an estate and demonstrating your efforts for CMS, for compliance in general. And so waiting for estates to have time to send out statements will definitely put you at risk of missing those 90 to 120 day filing periods, and it's completely not necessary and actually kind of counterproductive to the rules that you have to follow when a guarantor passes.
Amazing. And just another question here. What happens if there's just no estate? What happens if there's no estate in the situation?
Sure, I mean that happens, of course. Typically with a probated estate, there really isn't such a thing as an assetless probate estate, unless you run into a situation where somebody is suing for wrongful death and realizes they don't have a case and there's no other assets to administer. That's very rare. But if we're talking about a non-probated estate, it's oftentimes true that the decedent didn't leave behind assets. And in those cases, our process is to close the account and document what the personal representative has told us and continue to, in the background, monitor should new assets be discovered and then a probated estate case open later. But yeah, if there is no estate and you document that, you've complied with all of the requirements that you have from a compliance perspective, and you've also created the right kind of what we call a survivor experience.
Amazing. And it looks like we have time for maybe just one more question here. How is this handled with the cost report?
So with the cost report, I'm sure most of the audience is familiar with that. It's the report that the Centers for Medicare and Medicaid get in terms of accounts that are eligible for reimbursement. So if we're talking specifically about the population of guarantors that are over the age of 65 and therefore Medicare eligible, what is required in the provider reimbursement manual and by federal regulation is that you are collecting in general for a person who's a guarantor who's alive and a guarantor who's passed. You have to make real and bona fide collection efforts to the point at which when you're finished, you can say the debt is actually worthless and there's no likelihood of collection in the future. What that looks like in the context of a guarantor who's passed is that you're searching for an estate. So kind of like I mentioned before, sending statements and making phone calls to someone who's passed away doesn't make any sense. What makes sense and what is required by the cost report is to have processes in place to search for estates as long as it takes for the majority of estates to open, right? Because that's when you can say the debt is actually worthless. If at the end of that time, there is no estate. And documenting your efforts too. We've had clients before, we work with them trying to do the process of searching for estates very manually, but nevertheless trying and not documenting their efforts. So it sort of becomes the tree that falls in the forest that no one is there to hear when an auditor comes and says, show me proof that you were searching for an estate. So you have to do both.
Yes, appreciate that added insight here. And thank you again to Nikki, Garrett, Drew, and Angela so much for your time. It looks like that is all the time we have for today. So thank you for the speakers, as well as DCM Services for sponsoring today's webinar. If you have any questions at all, please feel free to contact info@dcmservices.com or use the information on this slide. And remember to take a look at the resources on your console. Again, thank you for joining us today, and we hope you have a wonderful rest of your day.
Thank you.